I get the chance to bring to the conversation a little of my lived experience as a doctor working a consultant pediatric nephrologist for some years, service and team lead, even as a person that led change across a number of NHS organizations, including on boards as director of strategy and medical director, but also then working in the private sector, healthcare sector, serving the NHS in terms of very similar challenges as well. So if we go to the next slide, please, Carl. I just wanted to kind of summarize very briefly what we've been kind of touching on as we've gone through this webinar. I call this the triangle trap, where organizations are focusing on investment, productivity, and value, and yet what we are seeing, certainly in this country and others in the OECD, is a growing spend in healthcare, growing growth in need and growth in actual numbers of staff numbers, and yet activity keeps turning, and we are suffering or troubled by decrease in productivity and not quite the right value, both for the taxpayer and for the patient and for the organizations for that matter. So the ask and the requirement is a paradigm shift, is how I see it, a shift towards understanding population needs and patient needs, but also staff needs, which is the focus of today's webinar, so that we can actually get the outcomes we want, both in terms of investment and value, and get productivity to become what it should become in terms of an outcome. So that's just a summary of kind of where we are, moving from a current crisis to a different way of thinking. Next slide, please, Carl. This slide is to remind me to just speak about my experience at board level in one sense, which is I remember very vividly going through board papers where we talked about things, data, and narratives, which are really fundamentally about what was happening in the rearview mirror of organizations. And then the refrain would come up, we need to think differently. And I quietly would ask myself, what do people mean by saying that? What do you mean by saying that? Do we mean more quality improvement, more lean thinking? And actually, it was never really stated clearly what the approach needed to be. We were dealing with strategies that were set out, which were often aspiration, sort of boiling the ocean approach. It didn't really go anywhere. I remember vividly spending a huge chunk of money on leadership development, but as a blanket spend rather than a targeted, understood needs approach. Spent fortune trying to support teams and individuals out of difficulty, when I knew as a medical director that if we'd understood these needs sooner, we would have preempted them and actually saved a fortune and a lot of emotional heartache in terms of those difficulties that individuals and teams were going through. We also do this interesting thing, which is rewarding employees for great work, which is fantastic. But part of that is the sort of idea of employee of the month, which I think is an interesting concept, because we then wrap that with the idea of resilience. And I'm not a fan of the word resilience, in the sense that I think that it's turning the responsibility of the employer onto the shoulders of the very people already carrying the psychological, physical, professional, and personal burdens. And that resilience pizza, which is the summary of this, is of course unhealthy, unsustainable, unfulfilling. It's a transient transaction that is really quickly forgotten. Hence the need to actually move to something else. And this is what we've been talking about. So if we go to the next slide, please, Carl. I like to see one way to look at staff as they walk into the building is that they walk in with two big bags, right? So the organizations employ staff across the disciplines for their skills, whatever they might be, from fixing bones to safety taking patients from X to Y to get their care met. And yet we forget, or we do virtually nothing, if anything, about understanding needs and the inequalities that define that individual. And so I guess one question to then pose to organizations, which we do, is how much money do we spend to develop people? And if you look at the £1 that organizations spend, our analysis finds time and again, it's about 2p in the pound, about 2%. If you're lucky, it's a bit more, often a bit less. That's just the skills bag. We do virtually nothing to understand needs and inequalities. And therefore there's no surprise, as mentioned earlier by our colleagues, there's an increase in churn, there's an impact on productivity, and actually more importantly, the result of that isn't just the individual, but we end up with suboptimal teams. So a team in difficulty isn't the team itself in difficulty. It is individuals in the team that become are the source of the focus that is required, that disrupts and damages the team in terms of its ability to meet patient care optimally. So I guess one way to conclude from this point is organizations need to build new skills, new capabilities uh, to unpick and understand needs, also inequalities, to then begin to bring solutions that are uniquely constructed by that bespoke understanding, rather than that blanket spend on OD that is about leadership, for example, which is needed, but needs to be sort of targeted through the idea of need and understanding the need. We go to the next slide, Carl. Now, as a medical director, I recall very vividly that, when I was trying to meet the needs of individuals, quite often because of the nature of my job was individuals in difficulty, I would ask for data. I would say, okay, let me understand the individual in front of me before we rush to turning the levers that our organizational governance demands of us. And in fact, the question often raised lots of interesting data around the individual. And I began to realize very quickly that, and I'll take the medical model to start with, the doctor walks into a building. The moment they walk into the building, they're generating data. They're generating data in a key domains that I call professionalism domains. And I used to say, and it was true, and it still remains true, I could measure a consultant using about 38 data points that covered the entire range of professionalism, quantitative data, qualitative data, and even the absence of data was considered data as well. But this was data that was very complex, that included and required the story of the individual as a whole, to then be able to be very fair in terms of the engagement and meeting needs and solving problems for that individual. And yet, it took an effort, and it was starting at the wrong end. After the problem had arisen, I used to then ask myself, what if we were able to get to this data, if individuals access this data, get to the data, and understand themselves as well as the teams in terms of the richness of their data, so that we could then target needs. So if, for example, there was a weakness identified or a need identified, we could invest that really hard cash from the taxpayer really well, that enable the individual and then the teams to be the best that they could be. So if we turn to the final slide. Please, Carl. In essence, what this comes down to, in terms of what my colleagues have talked about to date, and what I've shared with you, which is a sort of very personal and lived experience perspective, is that all of this has to come together onto the idea of learning organization, as Naeem mentioned at the beginning. How do we become a learning organization? What is it to be a learning organization? Because this is exactly what Alder Hey is actually doing, learning more and more about its staff and its teams. Same with Liverpool University Foundation Trust. It isn't just about education department, quality improvement function, and research and innovation. These are functions that are about learning, but about the skills bag, if you remember that image. It is actually about learning the other things about that other bag around needs and inequalities. So we've talked about using data about people and staff differently. That's workforce decision intelligence at its best. We talked about staff advisory and liaison service, which is a national and international award-winning function in Alder Hey. That's also a powerful part of not just making a difference, but part of the learning aspect of the organization. And I've touched on the idea of professionalism as quite a fundamental data-rich and data-enabling capability that we can build it with organizations that helps them to become learning organizations. Otherwise, I'm not sure what we mean by learning organizations. So I've probably done my 7 minutes, Dave Joe. So I'd like to end